Hi, my name is Daryl Herlack, and I'm the Clinical Director of the Medical Surgical Orthopedic Unit. Welcome to Backus Hospital. I would like to tell you a little bit about our fall prevention program. We are a 213-bed, not-for-profit acute care community hospital in southeastern Connecticut and are the primary source of health services for nearly 250,000 people. Preventing falls requires a team approach, and at Backus Hospital, we believe that it is not just the nurse's responsibility to monitor and maintain fall prevention interventions to keep our patients safe. We would like to discuss our fall initiatives and highlight some successful process improvement changes that have contributed to a more comprehensive and improved fall program. Karen Long, our chief nurse, has implemented a unique approach to managing challenging patient care issues related to safety and care. Cross-sectional teams of managers and frontline leaders are brought together in a collaborative circle to address urgent patient care needs. These groups are comprised of frontline leaders as well as directors from both the inpatient and the outpatient setting. The Fall Circle and Collaborative at Backus Hospital used a do it now, do it next philosophy. The group identified strategic initiatives that must be addressed immediately and those that will be done on a long-term plan. Some of the immediate issues for the fall program that the group identified were standardizing the fall interventions throughout the organization. They are identifying the patient with a green fall bracelet, a fall sign above their bed, the patient's name in green on the door, the patient's bed alarm on at all times, and communicating the patient's high risk for fall status at all handoff reports. Education and implementation of the Hendrick II fall assessment in both the inpatient and outpatient setting. Cycles of change focused on identifying and improving communication of fall risk throughout the patient's experience. A comprehensive outpatient policy that identifies interventions for patients in the outpatient setting. Implementation of the safety huddle to improve communication among caregivers related to fall risk. Implementation of the volunteer safety monitor to assist with patients that fall in and out of a risk category. Outpatients that become inpatients. Throughout the organization, the fall program has been embraced and implemented to address safety concerns with patients in areas such as the emergency department, cardiac cath lab, post-anesthesia care unit, and in diagnostic imaging. The patient has risks assessed, interventions implemented, and then this information is communicated during handoff report. Throughout the patient's experience, caregivers are responsible for maintaining the patient's fall risk status. In diagnostic imaging, transport personnel reinitiate interventions such as the bed alarm when a high-risk patient returns from testing. Implementation of the safety huddle. The concept is taken from industry to address workplace hazards. It is focused on communicating the immediate safety concerns to our patients, such as fall risk, evolving change of conditions, and specific patient concerns that all team members should know. The safety huddle engages the team in a commitment to patient safety right at the beginning of the shift.
Hello, evening shift. We've had a busy day, and there are several people that I want to report to you that need some extra safety precautions. So even though we have 14 on our high risk to fall list, I'm going to talk about the people that we need to watch most closely. In 487-2, he's the gentleman, I'm going to use room numbers for confidentiality right now, but he's the gentleman that had been in 77. He's schizophrenic and he is very impulsive, so need to respond to his bed alarm. We just had a new admission in 90-bed 2. She's an elderly woman who has some acute mental status changes, although Ruth just, admitted her in the room or is getting her settled, and she said she's more forgetful, but she does have, probably will be a good candidate for the middle zone bed alarm.
How to conduct a safety huddle. Make the safety huddle mandatory participation for all oncoming shift members. The charge nurses at the change of shift review the high-risk fall report and discuss high-risk patient care issues. The charge nurse makes a clear announcement of the time to start the huddle and gathers the team. The huddle should last 30 to 60 seconds with a brief moment for the staff to ask any questions. The charge nurse keeps the promise to keep it brief.
Hi, my name is Bonnie Thompson. I'm the Director of Patient Safety here at Backus Hospital, and I just want to talk a little bit about our fall prevention program. It's a really neat program that we've been putting in place over the last couple of months, in which we start taking care of the patient from the moment they walk in the door until the time they leave our facility. We've really tried to make this a process, not a program, and a process that involves every single person here at the hospital. We want our staff to feel that everyone's responsible for the safety of our patients and for the outcomes that occur to our patients here at the hospital. So whether it's a patient walking down a hall that needs some assistance or somebody coming in for outpatient procedure that then gets admitted, everyone's responsible for making sure that we're doing everything possible to help that person not fall. And this is just a really good way for us all to work together and work as a team to make sure that we're giving our patients the best care possible.
Fall prevention at Backus Hospital is an evolving program that requires a team effort. It starts as you enter the hospital and it continues into our outpatient centers. We are constantly striving to find innovative ways to improve our fall program and address patient safety. Thanks.